Hi, welcome to my medical office. Today we're talking about UTIs or urinary tract infections. I'm going to tell you the most important things you need to know about UTIs that even some doctors and healthcare providers don't know. UTIs is an abbreviation for urinary tract infections. Some people call them bladder infections. They are incredibly common. Over 50% of women will have one at some point in their lives. Men get them, children get them, babies get them. It's when there's some type of infection, usually bacterial, but in some cases it could even be caused by a fungus, even though that's much more rare, overtakes the bladder. In many cases, it can produce symptoms, but not in all cases. We see them in every age group. Sometimes once, sometimes they're isolated for a woman or teenage girl, and sometimes they can be chronic or recurrent. Basic symptoms of a UTI include urinary urgency, so feeling like you have to get to the bathroom, burning or pain with urination or voiding, and urinary frequency. Sometimes there can be associated feelings of fatigue or pelvic crampiness, sometimes radiating to the back. And then in rare cases, if this infection spreads up from the bladder to the kidneys, it can cause something called pyelonephritis, which is an infection in the kidney. The first thing you should do is get a liter of water and start drinking it. If you decide to get treatment, and that's been given to you by an urgent care provider or an emergency room provider or even your regular healthcare provider, you want to ask, is this the right antibiotic? And again, remember the gold standard are either fosfomycin or Bactrim. Are you taking the right antibiotic in the right dose for the right period of time? It's generally not necessary to treat for 7 full days or 10 days in uncomplicated UTIs. So generally 3 or 5 days is sufficient, in most cases 3. My top 3 things about UTIs that I want patients and everyone watching and listening to know. Not every time bacteria is found in the urine is treatment with antibiotics necessary. We know that 40 to 50% of urinary tract infections will disappear on their own with no antibiotic. That being said, the symptoms can be really unpleasant and really uncomfortable. You know, we want to encourage people not to self-diagnose, not to self-treat or self-medicate, but to work with a healthcare provider so he or she can help you decide if treatment is necessary, and if so, what is the right treatment. Not every antibiotic is appropriate for a urinary tract infection. I can't tell you how many times I've had patients say, I started to have symptoms, I Googled UTI, and I just took the amoxicillin or Zithromax or Z-Pak that I had in my bathroom. Wrong thing to do, and actually can do more harm than good. If possible, it is really important to get a urine culture. A lot of people will go to urgent care centers or doc in the box with symptoms, and they get what's called a urine microscopy. And what this is an easy second test to do on urine sample that can give us clues as to whether or not the person has a UTI or infection. We get all this information in seconds, but this is not a urine culture. So if you go to an urgent care and they test your urine and come out of a room 5 seconds later and say it looks like you have an infection, that's this test. That is not a urine culture. A urine culture takes about 5 days to grow out in a laboratory, and that will tell us what the organism is and which antibiotics are appropriate for that organism. It is so important to try to get that urine culture, because if your symptoms disappear and then come back and you have to be treated again, we really need to know what that bacteria was that was causing the infection. There is no shame in this game. Everyone pees, everyone has a bladder, and most people have sex. So if sex is what triggered your UTI, I would say be loud and proud that that's how you got it. But there are some ways to prevent it in the future. Number one, we have a saying in medicine and surgery, the secret to pollution is dilution. What does that mean? Bacteria, when they're irrigated or hydrated or flooded out, have less of a chance of thriving and multiplying and surviving. So when you talk about your bladder, that means Drink a lot of water. Things that are more sugary, generally not good for your overall body, certainly can irritate your bladder as well. So plain water, peeing or emptying your bladder before and immediately after sex. And again, that's to kind of flush out any bacteria. And the other really big behavioral tip is you can take any moistened wipe or wet toilet paper or take a shower or a bath and just make sure that the perineum, which is the whole area from the urethra, the vagina, the rectum, is as clean as possible before sex. We have to remember when you talk about bacteria, you're oftentimes talking about things that are microscopic, that you can't see. So if you've had a bowel movement earlier in the day, you have sex later, trust me when I tell you, if I took a culture of the area around the rectum, 100% it would pick up E. coli bacteria. Cranberry juice, myth or fact? It's actually a fact. There is actually an elucidated mechanism, so we have an explanation for why and how cranberry can work to reduce the risks of UTIs, and it has to do with the adhesion of the bacteria to the wall of the bladder. And cranberry juice in some cool way really inhibits that. That doesn't mean it's going to work for everybody, and data seems to suggest that it's more effective as a preventative measure than as a treatment once someone already has symptoms.